for April 7th, 2026. And I will ask Valerie, are you at a point where you can see the chat and call for roll, please?
Will do. So Chair Fergus Loffridge,
Present.
uh, Brooke O'Byrne,
Present.
Senator John Ellison, Dr. Erica Rist,
Here.
Robin Dunkhorst,
Present.
Wendy Nelson,
Present.
Chris McCann, I saw Chris on here. Chris, can you hear us? I see that you are off of mute, but we cannot hear you. Okay, we'll give Chris a minute to work on that. Patrick Rogers is excused. Sarah Dearborn,
Present.
Judge Michael Montero. Not seeing him yet, but I believe he's excused. And Sheriff Jerry Allen. He's probably off working on emergency. So, Chris, we know we have you on here. And even if you're not able to get your mic to work, we still have a quorum. So, Fergus, we do have a quorum. Just let us know, Chris, when you're able to get your mic going.
So we are able, with a quorum, without Chris acknowledging, we're able to move forward. We'll go to public comment. This will be for anyone that's online that would like to provide testimony or comment, limiting to 3 minutes. And we cannot take action on that. It's just for the addressing the board. Anyone that would just do that raised hand mode, and we'll call on you. Okay, not seeing any. We'll move right along. The next will be the review and possible approval of the meeting minutes for December 8th, 2025. This item will be tabled to the next meeting. We're just having a little trouble in getting that information out to you. The next for the board will be the review and possible approval of the meeting minutes from our last meeting on March 3rd, 2026. Those were sent out by Valerie this last evening. The board have a chance to look at those, entertain a motion to accept or any edits.
This is Wendy Nelson. I so move that we approve the minutes.
I have a motion to approve. Is there a second?
This is Brooke O'Byrne. I second that motion.
Thank you, Brooke. Thank you, Wendy. All those in favor, say aye.
Aye.
All right. Any opposed? Hearing none on the marvelous group meeting. Next will be a review of our usual review of the annual report. I believe Valerie, correct me if I'm wrong, you want to table that until next meeting when you have some more time to go into that?
Yes, please. Thank you.
Okay, we will table said item. Next will be item 6. This will be an informational item for the board. Be a presentation of policy concerns heard by participants in meetings that were done across the state. I believe 3 of them, if I'm not mistaken, of the Behavioral Health Association of Nevada. The executive director, Steve Schell, is here to provide that overview for us. Steve, I'll turn the microphone over to you.
Hello, Fergus. Great to see you and great to see everyone on the call today. I really appreciate being here today. Thank you for including me in your agenda. I wanted to also give you an overview of the Behavioral Health Association, if that's okay, Fergus, just to kind of set, not sure if everyone on the call today is aware of what BHAN is up to and why we were established, but I thought it would be helpful to go through that as well. Just for full disclosure, I'm also chair of the WASHO Behavioral Health Policy Board, so really I've enjoyed working with your board, and that's why I was really excited to be invited to come speak with you today. For those of you that may not know me on the call, I've been in Nevada for about 16 years now, all in Reno. I've done a variety of things in behavioral health throughout the state. I designed and opened Desert Parkway Behavioral Hospital in Las Vegas a few years ago and served as the CEO while I commuted from Reno. And then I designed and opened Reno Behavioral Health Care Hospital and served there for a few years. And then for the last 5 years or so, I was at Renown as their first VP of Behavioral Health. And while I was there, I was able to get the Renown Crisis Care Center up and running. But now I'm really focusing my efforts on the Behavioral Health Association of Nevada. And I'm really excited to give you an overview of how this all got started, and then also share with you some of the key topics that I've been hearing around the state that I'm sure are not new to any of you. Fergus, I do have a presentation. Do you want me to share my screen, Valerie?
Yeah, if you could, Steve,
I
that'd
will
be
be
great.
glad to,
You can
yes.
see the
Bear with me as I figure this out.
The host and settings changed a little bit, so let me know if this doesn't work. Ah,
Yeah, let's see. Do you see it now, Valerie?
it's
yes,
coming up.
in edit mode.
Oh, is it? Okay, let me see if I can. This should work now. How about there?
Yes.
Bingo.
Okay, perfect. All right, I figured it out. Thank you. Okay, so again, Steve Shell. One of the reasons why I really felt strongly that we needed something like the Behavioral Health Association about it is what is here on your screen right now. I will stress that a lot of these bullet points, I think we have made tremendous progress on as a state over the last couple of years. But back in 2023, when I was toying with the idea of starting something like BHAN, these are what I consider to be some of the key challenges around our state. And some of these I'm sure sound familiar to a lot of you. Some of them you may not, have heard of or realize. But the first one was I really felt like we had very fragmented professional groups in our state. We have a lot of associations in our state that are doing tremendous work, and we certainly want them to continue. BHAN is not here to replace them or duplicate what they're doing, but I just felt like we had some fragmentation there that I was hoping BHAN might be able to help ease. Insufficient representation of non-clinical professions in some of our planning efforts. I will say that I think we're doing a much, much better job on that. And what I meant by this bullet is I really felt strongly that peer recovery support specialists, case managers, CHWs should definitely be at the table when we are developing strategic plans for behavioral health. And I felt very strongly about that. But I do think we've made a lot of progress in that area. I think I see a lot of peers and CHWs that have been involved in planning efforts with a lot of us around the state. Lack of coordinated strategies. I don't think I have to tell any of you about that. I think we're doing better on trying to coordinate our strategies around the state, but we have such a vast state. It's been challenging through the years to really have coordinated strategies, but I think we're getting better there. Limited services, which I don't think I have to tell any of you about. Workforce challenges, of course. Reimbursement concerns, and then legislative opportunities. And that's what I kind of considered what was the current state of behavioral health 3 years ago. Some of these on this list still exist today, but I think we are chipping away at those slowly, as I think all of us on this call probably are. But that just kind of gives you an idea of how BHAN sort of came about and why I really felt strongly that we needed an association like this. So just to give you a short overview of BHAN, As I said, it was established back in 2023 as a 501c3, and I have certainly learned quite a bit about setting up a nonprofit, more than I ever wanted to know. But nonetheless, we are fully established by the IRS as a nonprofit. And also in 23, I convened a planning committee that consisted of various behavioral health leaders from around the state, some of whom are from our rural and frontier areas. And I convened them to really help me work on the details of the association. This wasn't just about Steve Shell deciding to stand up a new organization. I really wanted to bring a strong group of leaders from around the state to really help me build this out. And that was very helpful. And from there, we formed our initial board of directors. We held statewide kickoff events in Las Vegas and Reno, thanks to a donation that I was able to receive from the Nevada Health and Bioscience Corporation in Las Vegas. And then we also received a gracious donation from Molina Healthcare, and that allowed us to join the National Council for Mental Wellbeing in DC. I'm not sure if everyone on the call is familiar with the National Council. They've been around for about 60 years. They were the driving force behind the CCBHC model a few years ago and really worked tirelessly to set up the federal funding and the state funding around that. But they've done a whole host of things. They also do the mental health first aid trainings that some of you may be familiar with. But I felt very strongly that we needed to be aligned with a national partner such as National Council. And they have certainly brought a lot of resources to the table that we have not taken advantage of as a state, and more to come on that. But just very excited that we're a part of National Council. And so anyone who actually joins our association automatically becomes a member of the National Council. You'll see this in just a moment, but part of our focus at BHAN is on prevention. And so we're kind of diving into that area a little bit around the state. And we recently received an opioid education grant from the city of Reno to focus on the business community in Washoe County. I felt for a long time that our business community was not really included in community prevention efforts like they should. And so we've been working to bring together business leaders and help their employees learn more about the opioid crisis. And then lastly, we are a membership-based organization, but we have not excluded anyone from our events that you'll hear about in just a moment. So that's just a little bit about our progress along the way. Our mission statement, we took a lot of time and effort in putting this together, but I'll just read it quickly. The Behavioral Health Association of Nevada's mission is to promote statewide collaboration among behavioral health professionals and allies through active engagement in policy development and communication strategies to increase the focus on prevention and improve accessibility and sustainability of treatment and recovery options for all Nevada residents. And I just wanted to call out a couple of key words in our mission statement, the first being collaboration. You know, as I said, that's really why the association came about. I and others really felt like we needed more collaboration, not just in certain areas of our state, but certainly statewide. And initially, I was only going to focus on Northern Nevada, but I had a lot of my colleagues really encourage me strongly to just go statewide out the gate. And that's why we started out with a statewide organization. The next key word is sustainability. I've seen a lot of great programs that have been developed through the years, but have not made it for the long haul for various reasons. And sometimes that's attributed to funding. And so I really felt strongly that whatever we try to collaborate on or recommend around the state, we really need to be mindful about the sustainability piece. And I think all of you can certainly relate to that. Our pillars of purpose are very simple. Government affairs is what we're very focused on. Partnership and resource development, helping connect people around the state, helping figure out who's good at doing what. And, you know, we have some organizations that are trying to do everything, and some of them can certainly do that well, but not every organization can certainly try to do everything for everyone. And so we're trying to connect those players around the state where we think they can align their resources and probably improve the efficiency for both organizations. Networking is another big focus, which I'll go into in just a moment. Strategic planning, and then workforce advancement. Some of our initiatives that we've had over the last 18 months or so is we've been holding regional meetings, both in person and virtual. And I will say, as I'm sure all of you on this call today can attest to, it is a challenge to try to bring together everyone from our rural and frontier areas. I have attempted some regional in-person meetings for our rural and frontier areas, but I think we're going to probably stay focused on virtual meetings as much as we can while we try to figure out how we can bring our rural and frontier partners together in person. But I will say that that has been a challenge. But we have been having in-person meetings in Reno and Las Vegas, and our rural and frontier colleagues are certainly welcome to join those meetings at any time. In August of last year, we had a legislative recap where we went through the 2025 session and talked about all the highlights. Valerie Haskin was a huge help to me on that, as you all probably know, with her expertise. And then Valerie really encouraged me to think about doing a monthly policy forum. So thanks to Valerie, back in November, we launched our new monthly policy forum. And we have about 300 people that have registered for this monthly meeting, and we've had very strong attendance. The purpose of this policy forum is to really bring up new ideas for policies, talk about existing policies that we may need to recommend to be amended in such a way, in our coming session. It's really to help engage all of us around the state to really talk about policy. And just to let you know, our next topic in April coming up, or in this month coming up, will be on mental health parity. You'll hear in just a moment that is a big topic that's really gaining a lot of traction around our state at the moment. So we're going to have the Nevada Psychological Association come and talk to us about AB 207 from the last session, but also talk about where they are headed in this next session as it relates to parity. Our website, bhanv.org, is what we're wanting to kind of become a central repository for our state. It's definitely a work in progress. That's where we want, bills to live, best practices, where people can connect with each other and so forth. So that is definitely evolving. Our clinician well-being work group is what we formed just a couple of months ago. I will say clinician well-being is a topic that we've really been hearing a lot around the state. And Valerie Haskin can also attest to this. She's been hearing the same thing. But we really want to make sure our clinicians who are out in the trenches providing the behavioral health treatment for our residents, we want to make sure they're also being cared for. And so we're in the process of developing some type of peer support network specific to behavioral health clinicians. So more to come on that. I'm very excited about the work group we have formed. A lot of energy and a lot of expertise there, but I think you'll see some positive things come from that. Our policy roadmap, we are going to have that finished by the middle part of this coming summer. That is just going to be a compilation of all of the different policy ideas that we have heard around the state. And it will also highlight the policies that we're really going to be encouraging our legislators to really focus on in the coming session. So I will make sure Valerie and Fergus get a copy of that so that they can get that distributed to all of you. But be on the lookout for that in the middle part of the summer. I mentioned National Council for Mental Wellbeing. I brought their CEO out in October to attend our meetings, and he was very amazed at the great work that we're doing in Nevada. And I actually drove him to Elko from Reno, so he was able to see some of our remote areas of Nevada, which was really great for him to see. So more to come on National Council in the coming months, but just very excited about our partnership with them. Art for Recovery is a fundraiser that we're doing in Reno and Las Vegas to raise funds to go towards behavioral health programs. Last February, we sponsored the Behavioral Health Day at the Nevada Legislature, and we had over 200 behavioral health professionals from around the state that joined us at the Capitol. And we had meetings scheduled throughout the day that they could attend with various legislators. And then we were recognized on the Senate and Assembly floors. But that was a really, really great day. And we're going to be doing that again next February of 27 when our next session kicks off. And then lastly, collaboration with other statewide organizations and associations. I'm in the process of convening a meeting to bring together all of our different associations in the state. I don't think we've ever had something like this. And if we have, it's never been on a consistent basis. So I'm in the process of bringing together the Hospital Association, primary care, social work, and so on to the table so that we can all figure out how we can all work together. Because again, BHAN was not established to replace any of them. or to certainly duplicate their efforts. We just want to work side by side with them and help fill gaps wherever we can. Okay. I did mention the policy roadmap. I'm very excited that we're going to be having this come out, but the middle part of this summer. And I'm going to go through the next couple of slides that contain some of the key policy topics that we are hearing around the state. And some of these, I'm sure a lot of you are also hearing about, and I'm sure there are lots of topics you could certainly add to this list. So our first topic that is really, I hear all the time around the state, which I'm sure none of you are surprised about, is Medicaid reimbursement. This has been a big challenge in our state for many, many years. But I will say we have some outstanding leadership in the Division of Medicaid that have really done a great job of getting us some rate increases for different levels of care. So very excited. Some of those have already been approved by CMS. Some are still awaiting CMS approval. I will say the one area that we're still hearing a lot about are the rates for practitioners who are in private practice, or the work being done by private practitioners. We know those rates are going to be up for a rate review in the coming year, and so we're going to be working very closely with our colleagues in the community, along with the Division of Medicaid, to really make sure that a really effective survey or review of those rates is completed so that we can possibly get them rate increases. We have some providers around the state that are really on the verge of having to decide whether they continue to serve Medicaid members or not, and we really don't want to be in that position. We really want to make sure our rates of reimbursement are keeping up with our cost of living and so forth. And we haven't had rate increases in a lot of these areas in over 13 years, while our cost of living has certainly gone up. And so that's something that we've been keeping a very close eye on, but very, very optimistic with what our Division of Medicaid has been doing. Mental health parity and addiction equity. This is a topic that is really gaining a lot of traction at the moment. Some of you may be familiar with AB 207 that I mentioned a few minutes ago. That was passed in the last session to require the state to conduct a review of all of our payers in the state to determine whether or not they truly are following the parity and equity law that was established many, many years ago. And some of you may have seen the recent report that outlines 16 payers that have not been following parity and equity. And so we can't certainly advance behavioral health in our state if our payers are not following the parity and addiction equity law. And so where we go from here on this is I'm working very closely with the Nevada Psychological Association and others to determine what really should be our next steps on that. Now that we've determined and we've actually confirmed that parity is not being followed, what do we need to do next? Because access is a big issue for our state. We want to make sure residents have access to the care that they need. And we really don't want parity to be creating a barrier for people to have that access. So more to come on that topic. I hope you will join us at our policy forum on April 21st. Valerie can certainly send out the link if you don't have it, but hopefully that will be a good discussion about what our next efforts need to be. Payer credentialing is also something I'm hearing quite a bit about. I'm not sure if you're really running into this out in the rural and frontier areas, but we are seeing it more and more in Reno and Las Vegas. This is where we have different providers that are trying to get credentialed with payers, but it's either taking a very long time, and by a long period of time, I'm talking about months to get credentialed, while we still have residents in our state trying to get access to care. And so I know the Nevada Health Authority is doing a lot of work right now around payer credentialing, so hopefully we'll see some good things come from that. But we really don't want to be clogging up the system for our providers who have been trained to provide care for our residents, and we don't want them to have stumbling blocks in trying to get credentialed with the payers. Clinician well-being, I've already mentioned, is a very key topic, and as I said, more to come on that. The next two, I'm sure you all are very familiar with, the Children's Behavioral Health Transformation and the Rural Health Transformation Program. Very excited about the great work that's being done in these two areas. And hopefully we as a state are going to be using those dollars very wisely. This is a huge infusion of money into our behavioral health services, and we want to make sure those funds are used, to the highest level. So lots of great work, I think, is being done in those two areas, and we're all very anxious to see what comes from that work. The crisis response system of care, I know your board and others have done a lot of work in this space. We've done a lot of great work in building out our system of care around the state. Still have a lot of work to do. We have seen crisis stabilization centers now established in our state. We have the 988 call center that has been built out and expanded what crisis support services was doing. We still need work to be done on the mobile crisis teams, which is that second level, that mid-level of the system of care for crisis response. I know there is some work taking place at the state on that, along with some of our counties around the state. But I think that is one piece of the system of care that a lot of us are still watching closely. We've done great to figure out, to really get our 988 established and to also get our crisis stabilization centers up and running. But we don't want to forget about the mobile crisis team. So I think a lot more work to come on that. The last one there is something that we've been discussing at our Washoe board, but I'm also hearing it throughout the entire state, and that is our cell phone surcharge that was established 2 sessions ago, where every cell phone has a surcharge, and those funds go into what is called the crisis response account. Now, those funds were originally intended to go for all levels of that system of care, and they have. For the most part, they've gone to the 988 system in Carolina, but we want to make sure those funds are also being utilized for the mobile crisis teams and the crisis stabilization centers. But we feel strongly that 35 cents per month per phone may not really be adequate. We know there are other states around the country that have a surcharge of $1 or greater per phone per month. And so that is something a lot of us are taking a look at the moment to see if that may be something we could introduce in the 27 session and then generate more revenue for our crisis response system of care. Some other topics, again, I'm sure a lot of you are already very familiar. I will say grant funding is a very hot topic at the moment because we have a lot of organizations in our state that depend very heavily on grant funds. And I don't think I have to tell you about the trauma that was created in January when the federal government announced that a huge chunk of SAMHSA grants around our country were being eliminated literally overnight. We had some organizations in the state that were already closing out their offices that day, had informed their staff and so forth. And then by that evening, we learned that those grant terminations had been rescinded. But the trauma of that has really been great around our state. I am still hearing quite a bit about that. And I think one of the consequences of that I'm very nervous about is we have now a lot of people that are very, I think, nervous and anxious about working for grant funded programs. And those of you on your board know what I'm talking about when I say our state has really depended on grants for many, many years to fill those gaps in care that our general funds have not been applied to through the legislature. And so we really can't afford to be losing any grant funding in our state. And we have a lot of people now that are skeptical about working for grant funded programs because of the sustainability of those grants. So I'm hoping that we can get through this. I know that the Trump administration is already now talking about cutting some of our social service programs in order to cover the military budget. So I think we're just all going to have to keep a very close eye on that and see what comes from that and have to figure out how we have to be creative to keep a lot of our key programs going in the state. Family and youth peer support is a very big topic that I'm also hearing about. We have really been a trailblazer in Nevada over the last few years as it relates to peer support in comparison to a lot of other states. And I'm hearing more and more about family and youth peer support. I think there is a lot of great work being done around this topic, but I think more to come on this. But I think anything your board might be able to do to take a look at what's being done with family and youth peer support would be very appreciated. Competency, evaluation, and restoration. I'm hearing lots about this. I know we have a lot of our rural and frontier areas that are finding it a challenge to get individuals into Lakes Crossing, as well as the sister facility in Southern Nevada. And so I think that's going to be something that we definitely need to continue to keep our eyes on. We have people sitting in jails for months that don't need to be there. And so a lot of that, I think, is due to the pipeline of getting individuals into those state forensic facilities. And so that is something that seems to be coming up more and more. Still looking into that further, and I'm sure your board is probably already fully aware of some of those challenges, but hopefully some work, could be done in this area. Data collection and sharing. This has been a huge opportunity, I think, for a long, long time in our state. A lot of us are providing wonderful programs around the state with excellent outcomes, and we're even collecting our own data, but we're not necessarily sharing that data with each other. And I think when we talk about strategic planning and looking at new ways to deliver services in our state, I think we've really got to figure out how to collaborate on the data collection and sharing and really drill down on that and make sure, first of all, that we are collecting data that will be useful, but then what are we doing with the data? Are we getting it into the right hands of those of us that can really do something with that data and help drive some of the decisions we make? So that is something that's been brought up. I know UNLV and UNR have reached out to me wanting to talk about how they could possibly assist in this area. So I think there's more to come on that. Interstate licensure compacts. I don't have to tell all of you about these compacts. I know your board's done a lot of work around this. I think this is going to be a topic that we definitely hear again in the coming session. A lot of great work has been done around this in the past, but I think we still have a lot more work to do. But I do hear this coming up quite a bit among our professionals around the state. School mental health is still another big topic. I know there's a lot of great work taking place there. Clinical internship opportunities. We still have limited sites around the state where our graduate students can go and train in order to become licensed. And so we really want to make sure those opportunities are there. I think we're doing much better than we ever have, but we still have some students that are finding it challenging to find those internship sites. So I think that's going to be something we still need to take a look at. And then scholarships has really emerged over the last few months. As we talk about workforce development, it's been great that we have the student loan repayment programs, and we certainly want those programs to be there and continue and flourish. But we want to focus on the scholarships to get students into these programs first and foremost. We have a lot of people that struggle to just make ends meet while they're going to college. And so if we're trying to increase our workforce, we also think we need to be focusing on getting those individuals into the bachelor's level and graduate level programs through scholarships. So more work to come on that as well. So again, those were just some of the key topics that we've been hearing around the state. I'm certainly willing to and able to elaborate on any of those, and certainly hear from all of you if there are any other topics that you think might need to be on our list. But that's just a list that we have accumulated over the last year as we have our regional in-person and virtual meetings and our monthly policy forums. Those are the topics that seem to be keep popping up. Now, in terms of the legislative work around these topics, that still is being done along with all of you and then the other boards and others around the state. So, but those are just some of the topics I think that are really going to be a focus in our coming session. So Fergus, I know I covered a lot of information there and I went through a lot of that very quickly, but I'm definitely open to take any questions and go back and review anything that I may need to.
No, that's good stuff, Steve. And yeah, we'll be taking that list and overlaying it with what we've already discussed and kind of trying to prioritize where we're going to be focused this next year, where we can make the biggest impact. So I'll turn it over to the board. Board members have any questions for Steve while he's here yet? Not seeing anybody jump in there. Just go ahead and jump in. Identify yourself. Steve, I'll just point out, and I've been involved in some of our meetings with BHAN, and there's definitely areas that we need to prioritize. We talk about, you've heard me say this before, and I'll get on my soapbox again. We've worked very hard within the state, and everybody's addressing the workforce pipeline and trying to get that and the credentialing and things like that going. But what we've forgotten, and at the top of your list there was the reimbursement for the practices that are providing these services. So somebody gets their license, their credentials, they go to work somewhere. They're not hanging the shingle out on their own place. They're going for another practice and augmenting that. But that practice is not getting the reimbursements that's commensurate with what should be getting at this day and age. As you said, it's been decades since there's been a rate increase from Medicaid for some of these provider types, and that's just one of them. VA is no different. Medicare, no different. And then before we even talk about private insurance parity, in and of itself, the state can't take care of it, let alone trying to put it on the back of somebody else. So I think that's going to be a big priority this session, to keep those doors open. Otherwise, we got a lot of folks that will have certifications and things, licensure, credentialed, and they're going to be here for a little bit, and they're going to find out there's no place to work, so they're going to go elsewhere, and we're not fixing the problem. So that'll be one of the things. I'll get off my soapbox now. Valerie, I see your hand up. Go ahead.
Sorry, it helps if I mute. For the record, Valerie Haskin, Rural Regional Behavioral Health Coordinator. So Steve or anybody else on the board, what have you heard as far as different strategies that could be implemented within the legislative process to address payment parity from a private payer perspective? So, I mean, we have Nevada Medicaid and the reimbursement issues there, but what about the private insurance companies? Because from what I understand, it sounds like that's where some of the payment parity issues may be coming up too. So can you discuss some of the mechanisms that you may have heard and maybe what agencies may already be tackling them, or if there's anything that hasn't been tackled yet?
Yeah, Valerie, I will say I know the Nevada Psychological Association has been spending a lot of time on this at the moment and talking with many other states that have been instrumental in enforcing the parity law. So I'm waiting to get information on from them. We will definitely be hearing more on that at our policy forum on the 21st. But at this point, I really don't know where we're going with this. I know that the consequences for payers who don't follow the parity law are very, very minimal. The fines are very, very small. And I think that, not to speak for the payers, but that could be a reason why we haven't seen a lot of compliance around our country. If the fines are so low on, following the law, that necessarily doesn't prompt them to want to follow the law. So yeah, I just think that's going to have to be something we look at too. And I don't know how we do that legislatively, but I know NPA is taking a very close look at that at the moment. I'm very anxious to hear from them soon on what they have uncovered with other states that could possibly help us in Nevada.
Good to know. Thank you.
But I will say, on the topic of parity, I wanted to share too that some of you may not know that even with Medicare, we do not have parity as it relates to mental health. Back in 1965, there was a law passed that mandates that any Medicare member can only receive 190 days of lifetime care in a freestanding behavioral health hospital. And we're seeing more and more individuals that have not even reached their 25th or 30th birthday and have already exhausted those 190 days. And I know when I was running behavioral health hospitals in Las Vegas and Reno, we would frequently see individuals that had run out of their lifetime behavioral health days, and we could not get paid. We also were not discharged, of course, until the patient, the individual was ready to be discharged and was stabilized. I always made sure of that. But it also put a strain on the hospital as well, not being able to receive reimbursement for those days. And that is a very, very outdated law that we've certainly got to get changed. And that's got to happen at the federal level. There is a bill right now in Congress that's been put forward, and so we'll see what comes of that. A lot of us have been trying to to turn that around for many, many years. So I'm trying to remain optimistic about that. But we have even our own Medicare that's not even following, the parity law. Can you imagine if we put a lifetime limit on someone with cancer or with heart disease? I mean, that just does not, bode well when you're looking at parity for mental health. So more to come on that, I think, as well.
Absolutely.
Yeah, good point. And not to keep kicking this around, but if we don't start within the state first with our programs, whether that be Medicaid, Nevada Health Authority working on and addressing this, it's hard to put that ownership onto a private, uh, the MCOs or whatever that might be that are coming along in the state. The MCOs are just a small part of that for the Medicaid, but it's the other payers. If we don't have a standard set in and of itself, um, that we can hold them to, we're going to have a problem. That what I'd submit. Sarah, go ahead.
Thank you, Sarah Dearborn for the record. And I just wanted to speak kind of from the Medicaid perspective on two of the topics that Steve has brought up. Of course, Medicaid reimbursement rates. So I have heard the same things as you all. Absolutely. So wanted to flag that if you haven't heard already, there was a state plan amendment recently approved through CMS to increase behavioral health outpatient rates that are more specific to children. So for some of the services that our licensed professionals are doing, like our just traditional psychotherapy codes, those will receive rate increases, but we had to narrow that range. I don't know if any of you joined me on a March 2025, I think it was last year, public workshop where we had originally proposed rate increases across the provider types, across ages. We had to kind of quickly narrow that scope. And so that's where it went now reserved for children's services. So our focus first is on children. And then I think there's obviously excitement around trying to get those rates increased across ages. So I know just speaking from Nevada Health Authority, momentum is there, but we certainly need support from all of you as well. And then peer support services that were part of that state plan amendment were increased across ages. So that is not specific to children. So again, little by little, we're trying to make progress there. And then the last piece, just speaking about mental health parity, Nevada Medicaid is also required to perform mental health parity reports. Our mental health parity report is under CMS review currently. So once we get the go ahead, I don't know if it necessarily gets approved or we get told what we need to do differently. That will be posted on our webpage as well. So even though Medicaid doesn't traditionally go through division of insurance like all the other payers, we still have our own parity process. So once that page is available, I'm happy to provide that connection to Valerie so she can push it out too.
Thank you, Sarah. Other questions, comments while we're on this topic? Valerie, that again.
For the record, Valerie Haskin, Rural Regional and Behavioral Health Coordinator. I just wanted to mention to the board that it does sound like there is a member of the assembly who is probably going to be bringing forward the social work compact into this next legislative session. Just so that, that's on your radar, that may be taken care of by someone who already has potentially bipartisan support. So while we know that that's something that we worked on last year, we may not necessarily need to revisit that for this year beyond simply the board considering supporting any legislation that may come up in that direction.
And that's just for clarification. That's the interstate compact for social workers.
Correct.
We had that our board had authored our bill for last session, and it did not see the light of day. We have some assurances that this is going to come back around, and with some emphasis. So we look forward to doing that. So let's put our focuses on something else. Okay. Other comments?
Fergus, this is Steve Shell. I just wanted to say that I'm so grateful that Sarah clarified that about the rate increase for providers who I had totally forgotten that. I know that just happened a few weeks ago with the approval from CMS, and I've got to remember to start mentioning that because that is a huge triumph.
Yeah, I will echo that also, because it was like, okay, has the kiddos covered, but what about the other part of that we're seeing? So that is absolutely worthwhile. I had Sarah pulling some information for me regarding rate increases and decreases going back through that decade plus that we were talking about, Steve. I'm trying to get some information on that. So appreciate that. Okay. Steve, thank you. Let's keep this moving along. Valerie, let's go to item number 7. If you have a brief update where you're at in the world and what's going on.
I do. Let me just get this junk show up here. I promised that I would not make this death by PowerPoint. So we will make this snappy. So I was going to do something a little bit different with my brief update this time. It is a part of my scope of work, as I am subgrant. I work through subgrants from the Nevada Department of Health, or Department of Human Services, Division of Public and Behavioral Health, Bureau of Behavioral Health and Wellness, through SUPTERS and Mental Health Block Grant, and I have to do some TA. However, there's some opportunities to do that. Please excuse my voice and any kind of spaciness. I am very sick, and I am at the RX Summit in Nashville, so the time change or time differences and illness have got me through a loop, so my apologies. So first, I want to talk about recovery-friendly communities, which is a project that was in my scope of work. And essentially, the purpose of this was to do an environmental scan to identify what assets and gaps exist within the rural region and its communities to support recovery. And when we're talking about recovery, we mean people who are in recovery from substance use disorders of various types and or mental health conditions. And with this, we want to answer 2 questions. What would a recovery-friendly community look like in the rural region? And then what assets and gaps currently exist within that are in line with this, to give us a jumping off point as to where we could start to work. So I had been doing some research and looking at different models, and there didn't seem to be any really clear, distilled explanation of this kind of concept that wasn't aligned with some sort of very specific initiative. Lucky for me, yesterday I was at a session here at the RX Summit, and I attended a session called Building Recovery Ecosystems That Work, Sustainable Community-Driven Models in Action. And this was a presentation by Shelley Wisman, Tara Hyde, and Nikki Soda. And so the next couple of slides really summarize kind of what this recovery-friendly community would look like, and some basic concepts that we can have as a kind of a common understanding moving forward. So they call this a recovery ecosystem. So this ecosystem is a network of resources, care providers, and other services that really help provide and support for people in recovery. And this happens through coordination of treatment, coordination of social services, employment, and then community connection. So that ecosystem bridges gaps that we've seen where people can fall through the cracks when we have different handoffs and different care coordination issues and fractures within those systems, where maybe they're referred to care over here, but what they really need is this other program, and they've heard about it, but they don't necessarily get there. And so this ecosystem helps smooth that out. There are many models, but there are some common themes, and these are some of the common themes that were talked about in this presentation. First, cross-sector alignment. So making sure that everybody has common goals and collaboration, which is one of those reasons why I'm talking about this here, so that we're kind of all starting from the same page. People with lived experience are put in leadership positions. So they're not just supporters or admin assistants, but they are helping drive what the system actually looks like. Long-term, the focus is on long-term stability versus that band-aid of short-term crisis response where we get them stabilized and then nothing happens. We start looking at measuring well-being, not just mortality. So yes, we obviously want to keep people alive, but are they just alive or are they thriving? And when people who may be using drugs or be suffering from substance use disorder are thriving, it really helps the people around them and the communities around them thrive as well. And investment goes beyond treatment alone. So focus on peer support and services that promote community connectedness. And then that accountability is tied to outcomes, not just necessarily people served, numbers and volume. So what does this look like? I think the big thing that stands out to me is a recovery-friendly community is a place where it's easier to find connection than substances to use. Easier to find connection. And that means not just connection to care and access to care, but connection to other people. So that is those non-clinical support. So people or places where you can connect with other adults that don't include alcohol or substances. And this could be anything from recreation programs. This is faith communities and congregations, volunteer organizations, and all those other places where people can build those connections within their community and feel like they are a part of the community. And recovery-friendly communities are those that feel safe and vibrant. You know, we're not talking about a place where it is easy to get substances, which I think that's kind of a common misconception. Yes, there may be some harm reduction in some recovery-friendly communities. What that may look like looks like different things in different places. But what we're talking about with this particular concept is really what, clean streets, people are employed and working within their communities, and families are working well together, and there's this level of cohesion that I think is a common denominator here. So next steps for this project, identify a specific model. I think I'm going to go with the Recovery Ready Communities model that I believe is out of Kentucky. I'm going to complete an environmental scan of just community assets and do some key stakeholder contacts, make sure that I have my ducks in a row, and then submit that report to my SEPTERS program staff at the Bureau, as well as you guys, the board. And that report will also be published to the website for the RBHCs, which is nvbh.org. The other project I wanted to give some heads up on is 988 and Nevada's crisis response system and how I'm helping support those efforts. So stuff that's happening at the state level. So NAMI Nevada is leading the 988 coalition and its subcommittees. Those are up and rolling. They have really great attendance. The Division of Behavioral Health and Wellness the Bureau of Behavioral Health and Wellness is putting together an anti-stigma campaign, and I'll be helping them get some of that information out. Of course, there's the Mental Health Awareness Month, and we've got some great local organizations like Humboldt Connection, Zero Suicide Elko County, and others that are doing some fantastic community awareness events there. But also the local level NAMI affiliates have been contracted to do town halls about 988. And in our region, that's specifically NAMI Western Nevada and NAMI Northeastern Nevada. And so when we look at these town halls, the purpose is to give communities the opportunity to hear a little bit more about 988 and learn a bit more about what it is supposed to be, and then also provide real-time feedback to NAMI, but also there are going to be state bureau representatives there as well. So information that they can use to help improve processes and services. There's 2 town halls currently scheduled. I believe they're next week. So one in Lovelock on April 13th at 11 a.m. and one in Winnemucca on April 14th at 3. I will include the flyers for those in the materials that I send out to you guys, and also post to the website. And then NAMI Northeastern Nevada is also looking at scheduling their town halls, probably starting, I believe, end of April into May. There will be one or two that will be in person, I think. And then we're also talking about doing some ones that are online as well, just so that if those who maybe can't get to the in-person events want to participate, they will still have the opportunity. Other things I'm working with is working on regarding this is I'm working with the state to design an ongoing continuous quality improvement meeting with not only the state bureau project managers, but also we're going to bring in Carillon and we're going to bring on in CSSNV and specific stakeholders to do some quality improvement with things that we're and feedback that we're receiving from our stakeholders on an ongoing basis. So while we have the town halls as like time and location specific snapshots of feedback, we wanted to have something that was a little bit more ongoing to work out the bugs. We're going to start this focused on rural communities as a whole, so not just my region, but also the others as well. And then probably grow into a whole state effort. I do kind of want to keep the initial focus on rural communities just because when we start making it a whole state effort, we may start seeing a lot of resource connection issues in our more urban environments that don't necessarily relate to our rural communities. And while those are very important, my work and my role is to focus on serving the northeastern rural counties. So I do want to make sure that there's a stronger focus there, at least to begin with. And then really this is an effort to increase communication between our local stakeholders regarding those system improvements that are needed, and then closing those feedback loops and showing them what the state and their contractors are doing to improve those systems. Within that and related to it, I'm also putting together a draft community member feedback survey. So this will be open to the public. And it's just another mechanism for ongoing feedback for continuous quality improvement. So while there are ways to report concerns or complaints directly to Carillon, which is the primary contracted agency for the 988 call center, who then also works with CSSNV to serve Northern Nevada. We want to make sure that that information just doesn't go straight to Carillon and maybe doesn't get necessarily pulled over to the state. So we want to make sure that there's an open conversation across all the stakeholders and that it's handled with a lot of transparency. The responses from these will be currently collected by me. If the state wants to take this on and make their own survey where it's collected and handled by them, great. I know that it's not necessarily something that I have to own. And then I will take that information and deliver it to the DPBH Bureau of Behavioral Health, Wellness, and Prevention with their 988 and crisis response team. And then we'll look at what the feedback is and bring in the key stakeholders that are related to that into those meetings. We may also have specific topic area meetings where we reach out to specific community groups like, hey, we haven't heard anything from tribal communities. Maybe we should have a CQI meeting where we focus just on meeting with our tribal health clinics and say, what are your experiences? Have they been good? Have they been bad? Like, if you haven't had any experiences, why? What's the concerns and what can we do to alleviate that? So there's a lot of different things that we're talking about doing this with this particular project. It'll probably be launched the next couple of months. Also in line with that is I am hosting a webinar where we're going to have the team from Wayne State University talking about their crisis response training for clinicians. The 988 Coalition has also just recently put out a draft curricula that it will be worked on by the state to kind of build out a training curriculum and certification process for mobile crisis responders. But we just want to get some more information out there and some different perspectives. So this is something that I heard about at CIT International last summer, and it seemed like it was something that was really nicely done. So the more information we can get, the better. Other projects, I'm also working with some stakeholders to identify a project for the Rural Health Transformation Grant proposal. It'll probably be like a most fast hybrid. We're trying to hone down some ideas before we connect with law enforcement because we don't want to bring them something that's not really crystal clear, and we want to be very specific. about what that would look like for them. I'm resuscitating our postvention project, and that would be a toolkit for businesses and organizations in rural Nevada, for if they do unfortunately experience a loss, of either a member of their group or one of their family members to suicide or potentially overdose or maybe another issue, and how that can really be handled, and give them some human resources tools, and communication tools. There's some great projects and things that are available specifically for school districts, but we don't have anything just for community organizations in rural Nevada. And there are some good examples out there that are meant for municipalities and large communities or businesses within large communities, but that doesn't necessarily work very well for places like Elko and Winnemucca and Ely, and our other rural communities. I'll also be bringing back our alcohol assets and gaps analysis. It's very similar concept to that um, recovery-friendly community assets and gaps analysis. We're just looking at what we have that is helpful and hindrance to people who may be looking for treatment and to enter recovery from alcohol use disorder. And then behavioral health provider crosswalks. I am almost done with the update of the first iteration. I had some corrections to do regarding psychiatry, and also drug and alcohol provider types. So working on that. And then also renewing some efforts to bring back a community provider crosswalk that'll focus just on community health workers, peer recovery support specialists, behavioral health and wellness practitioners, and then also the prevention specialists. And then, of course, anything I can do to help you guys prepare for the VDR. And that is it from me. Any questions?
Questions from the board? Valerie, I'll be brief. As the chair, with respect to the recovery-friendly communities, as you go through that and that's being developed and put out, if we could possibly address or try to flush out in other communities where this has worked, the perceived barriers to implementation, whether that be networking, communications, leadership, funding, whatever that might be, that would help communities as they move to implementing that.
We'll do that. It's a great idea. Thank you.
Okay. Board members, other? Okay, thank you, Valerie. Next, we'll move on to the public comment section as we close out this meeting today. Public comment, anyway, after hearing all this dialogue, brave enough to come forth with anything? Put them all to sleep. Okay. All right. With that, I want to thank everyone for taking the time to get on the call with us today. Again, try to keep them brief, but there's just so much going on. Continue to think about legislative agendas as we get in, and we're getting primed. All of our fellow policy boards are doing, or to identify their policy issues. So let's have that ready for our next meeting. And Valerie, we're scheduled to meet. When are we meeting next? Do you recall?
Let's see. So the meeting will
May the
be
5th.
Yes, at 2 p.m. Pacific Daylight Time.
2 p.m. May the 5th. Okay. Are there any other comments for the good of the order from board members? Hearing none. Got it in just a little over an hour. So thank you folks for sticking with us. And with that, we'll call it adjourned. And anything comes up, give Valerie a call. Thank you, everyone. Have a great week.
Thank you.